In this video, I will share with you how to write a comprehensive discharge summary step by step. If you do not want to miss, stick with me. Hi friends, welcome back to this channel. If you are new here, my name is Dr. Farzana Hoque. I'm an associate professor of medicine currently practicing in the US. Over the last 10 years, while practicing medicine, we write discharge summary almost every day, multiple times. But we must know what are the tips we need to follow, as well as what are the things we must avoid while writing the discharge summary. In this video, I will share all those tips. As you know, discharge summaries are highly critical for safe patient care because they're essential for continuity of care. For example, you may be seeing this patient in the hospital. After the discharge, this patient will go to primary care physician or consultant or maybe nursing home. Wherever the patient is going, your written discharge summary is a critical element of that patient's continuity of care, ultimately affecting patient's future care and safety. So let's first focus on what are the elements you must include in your discharge summary. For this process, I will share the screen and show you that what are the things I have already added in my discharge summary template that also you can add for your discharge summary. Let's go here. As you can see in this screen, I have added patient's name, MRN number, address, age, birthday. Then one of the important element is admit day. You need to include which time was your patient admitted and then discharge date. After that, who is the admitting physician as well as discharge physician? Remember, it may sound very trivial. However, if there is any, after a couple of years, for example, you need to open up patient's chart or patient need to have this discharge summary access, all this information, the date, admitting physician, discharge physician are important. Let's move ahead. Now, the discharge diagnosis. You need to mention what are the discharge diagnoses. And then condition. How was the patient's condition during admission? How was the patient's condition during discharge? Is it stable? See what happened. And one of the important elements of discharge summary is this hospital course. And here I always mention, because many things we always review the maybe previous note, previous history and physical, previous progress note. Remind yourself that if you are collecting any information from other people's note, it is always ethical and highly advisable to mention it that, okay, you collect some information from them. Not all the information were collected by you. And after that, whatever the hospital course, you do not have to write whole HNP, whole history and physical. At the same time, the reader who will read the discharge summary must be able to understand why patient came to hospital, what did you do, and last thing, what was the patient's condition and what need to be done as outpatient after discharge. After hospital course, you also need to mention significant labs, particularly on the day of the discharge. How was the labs? And then, if there is a pending lab, remember, during the hospital course, it is not possible that, okay, we will order all the labs and get all the labs back, particularly, some rheumatology. It is very much normal that we will not get all the labs back, maybe some biopsy result, whatever it is. But those pending results are very important. So make sure you are highlighting here what are the pending labs, and very importantly, who will follow up that. Maybe primary care physician, or maybe consultant teams who will see the patient in the clinics. And then discharge exam. How was the patient's discharge exam? Was there any edema? Was there any lung finding? It is very important for you to document that because it is essential for patients' continuity of care. So after the discharge exam, disposition, meaning like, where the patient is going. Is the patient going and nursing home? Is the patient going rehab? Or if the patient is going home? And then discharge instruction. Remember, during the discharge, we talk a lot about patient's care with patient family. However, if it is not documented, it did not happen. So always make sure that you are communicating the discharge instruction as well as writing what are the patient's discharge instruction. So here you are mentioning patient's instruction, and after that, follow up, like, to whom the patients need to follow up. Tips will be a patient who is discharging from hospital must follow up with their primary care physician within 1 to 2 weeks. For example, if a patient you are discharging for heart failure exacerbation, it is advisable that, okay, this patient should see primary care physician or cardiologist within 1 week. So you are mentioning about discharge follow-up, discharge instruction, and then what are the warning signs? For example, how the patients will know what are the concerning symptoms. If you are discharging a patient with heart failure, how they will know that, okay, now they are at acute exacerbation of heart failure. So you need to include those warning signs. What are the weight changes they need to know? Another example will be like, you just discharge a patient with sepsis, fever. What will be their warning sign if they're having fever? What they need to do? You must document all those concerning symptoms. So as you see in this template, I have already included all those important headlines so that, when I am writing the discharge summary, I want to make sure that, okay, all these important points are there and not missing anything. So I hope you will find this helpful to include in your discharge instruction. So now I will stop sharing and then mention what are the other tips you need to remember. One of the important advice I will give you that, always try to write discharge summary on the same day. I understand you may be busy, having lot of admission, then you are discharging. Remember, on that day when you are discharging the patient, it's all fresh in your mind. You know what happened. So if you write that day, ultimately you will save your time. And another important component of discharge summary is like, the discharge process is medicine reconciliation. And it may sound very simple. However, medicine reconciliation during the discharge is critically important because you want to mention, you want to ensure that, okay, what are the changes you are making for patients is documented. Maybe, some home medication you discontinued, maybe some home medication you adjusted the dose. It is very important that you take your time to do the medicine reconciliation. So I hope you will find this video helpful, where you have already learned what are the components of discharge summary and fundamental tips to do a comprehensive discharge summary. If you like this video, please hit the thumbs up button and please subscribe to this channel because we are having a target of having 5,000 subscriber of this channel. So your subscription gives motivation to create more educational videos for you. If you are interested to know, like, what are the other tips you need to know for discharge summary, take a look at this video. Thank you so much for joining me today. I will see you in the next video. Until then, take care.